Incontinence is the accidental and involuntary loss of urine from your bladder. Now, there are different kinds of incontinence, but the most common type of incontinence is stress and urge or urgency incontinence. Stress incontinence is when you leak urine when there is a sudden and extra pressure on your bladder. Urge incontinence or urgency incontinence, on the other hand, is when you feel a sudden and very intense desire to pass urine. Now, it's important to distinguish between stress incontinence and urgency incontinence because the treatment for the two conditions is entirely different. A treatment for urinary incontinence depends upon the severity, the underlying condition, and more importantly, what you want. We usually start off with conservative management. These include lifestyle modifications such as avoiding caffeine, drinking the right amount of fluids, which is about 1.5 liters to 2 liters a day. Or if you're overweight, you can try to lose weight, as this has been shown to improve urinary incontinence. The other form of conservative management is pelvic floor muscle exercises, and we usually recommend that this is done under supervision either by a physiotherapist or a specialist continence nurse. If conservative management fails, we recommend that you have surgery. The type of surgery depends upon your underlying condition. We use patient decision aids, which are recently published by NICE, to help you choose your surgical procedure. Your recovery will depend upon the type of surgery that you have. You could have urethral bulking agents and you could be discharged home the same day. On the other hand, there are more invasive procedures wherein your recovery will be about 4 to 6 weeks. Pelvic organ prolapse is where one or more of the organs in the pelvis slip down from their normal position. The symptom that a woman gets due to prolapse is a feeling of a lump in the vagina, discomfort in the vagina, but it usually does not cause pain. The treatment options for prolapse depend upon the severity of the prolapse, whether a woman wants to have children in future, and her age and condition. We usually start off with conservative management. If the symptoms are severe, you could have a pessary, which is a device that can be put in the vagina. Failing that, or if you wish, you could have surgery.